According to the American Public Health Association, public health is the promotion and protection of the health of people and communities where they live, work, and play. Public health informatics plays an important role in fulfilling these objectives by integrating data from information science tools like mobile applications, aggregate databases, and even social media, and translating that data into meaningful information to help public health officials monitor and supervise health outcomes in a community, in a population, in a country, or even on a global scale throughout the world.
Vaccines are a great way to protect an individual and the public from infectious diseases.
Vaccine surveillance until recently has been very difficult, disconnected, and outdated. Newer computer systems and registries now compile individuals' data in order to form a more comprehensive immunization record. With electronic health records, data is constantly being entered and updated among participating hospitals and medical clinics.
I'm a nurse practitioner, and I've been a nurse for 20 years next year. Everything that we do is now on the computer, so all our orders and notes are all in the computer. I think of it as like patient medical records that people can access. We have like automated alerts for it's now the flu season, and the patient's been evaluated for the flu vaccine. The usual maintenance ones like tetanus and all that. Mm-hmm. We, especially the ones who have had like motor vehicle collisions and things. That's part of the trauma assessment is have they had the tetanus vaccine, and if it's not within recent recall, then they just go ahead and get it. Really frustrating that like when your patient was in one hospital and if they're not in the same like health system, a lot of medical health records do not talk to each other, so it's really annoying that you can't just look those up.
With the rise of vaccine-preventable diseases, understanding where vaccine coverage is lacking is important for strengthening state policy and projecting the spread of outbreaks.
Vaccine surveillance helps with tracking diseases, determining if there are any adverse events as a result of vaccination, and how effective a vaccine can be in preventing disease. In 2014, there was an outbreak of measles originating from the Disney Park in California. To monitor and show the spread of the outbreak, GIS programs were used. GIS mapping and available vaccine surveillance of kindergartners who have received the MMR vaccine or the measles, mumps, and rubella vaccine can be compared to show how poor vaccine coverage is the cause of outbreak patterns. Areas that had lower vaccine rates saw higher rates of measles. Similar methods can be used in simulations to test our country's vaccine coverage against disease outbreaks. Public health informatics systems such as this can further policy development for vaccine and vaccine exemptions.
It is so important to remember that some people cannot get vaccinated for different health reasons, sometimes allergies, and it sort of rests on us, the people who can, to take it upon ourselves to get vaccinated, to protect ourselves so that we don't infect other people. And it's also important to remember that just because you are not showing symptoms of something doesn't mean that you're not a carrier and you can infect other people if you don't. Like we saw with the adenovirus on campus, the more and more people that get vaccinated, that get the flu vaccine, that protect themselves from the cold, helps outbreaks of diseases like that to stop. Another thing to remember is that the VAERS system is there for your help. It is there to help improve the vaccine system and make it more effective and better for the entire public health system, because when you have an adverse effect, when you get a vaccination, it is important to report that so that for future references for other people getting the vaccination, it can be improved. Whatever adverse effects that you face can be addressed and taken care of so that the next group of people who come in for that vaccine might not have to face that. We know that the health world is always improving, it's constantly changing, it's constantly evolving, and the VAERS system helps us be a part of that, and that's really important.
Overall, we know that vaccine informatics is an emerging interdisciplinary field which emphasizes understanding of vaccine-induced immunity. Improved vaccine informatics technology will potentially help predict vaccine adverse events with existing genotypic data and could help in designing personalized vaccine. We also know that more support and technology in the vaccine informatics field can reduce the risk of outbreaks, increase cost effectiveness, and continue the momentum of people taking charge of their health care.
Vaccines are a great way to prevent the